Hello, everyone. My name is Madelyn Nieuwenhuis, and I'm applying to the brand program at the Fay W Whitney School of Nursing. This is my 10-minute YouTube video answering the 5 interview questions. Firstly, thank you for the opportunity to share a bit more about myself. I'm excited to walk you through how my background makes me a dedicated and resilient candidate for your program. The first question asks, nurses face ethical dilemmas. Tell us about a time when you experienced a situation where a classmate or peer was engaging in unethical behavior. How did you handle this situation? The situation I experienced was on a very busy EMS shift. We worked 24s. We were getting back-to-back 911s combined with nursing home and rehab facility transfers. And it was during a return transfer that I noticed my partner entering vitals data that I know he did not complete. I approached my coworker privately and expressed my concern that vital signs are a crucial aspect of care and withholding them compromises patient safety. I emphasized that documentation must always be accurate even when under extreme pressure, as falsifying records is a direct violation of our professional oath. And this person clarified that they just felt extremely rushed to get vitals due to the busyness of the shift. And moving forward, we agreed to establish a brief verbal check-in before the transport completes to ensure all points of care are completed. The second question asks, nurses often work as a part of a healthcare team. How do you work in a team environment? Tell us about a time you've collaborated successfully with others. My experience in EMS has shaped my belief that teamwork in a healthcare setting is a relay race, not a series of independent sprints. I define successful collaboration as the ability to bridge the gap between two high-pressure environments. So in my example, the ER and the pre-hospital care. So while working as an EMT intermediate in Sheridan, Wyoming, my paramedic partner and I encountered a critical OB patient who required multiple ALS interventions for the 30-minute transport to the ER. My primary task was drawing up medications and communicating a concise and detailed report to the ER. It was essential to confirm the receiving hospital team was aware of the patient's critical status to prepare for proper interventions. This also ensured the receiving hospital could transition the patient immediately to definitive care, likely surgery, without having to repeat assessments or start baseline interventions. Because of the clear prioritized verbal and radio report, the ER team was able to bypass the usual triage and had the surgeon waiting and the operating room prepped upon our arrival, saving crucial minutes for this patient. This experience solidified my understanding that the highest level of collaboration relies on mutual trust and clear communication across all disciplines for the ultimate benefit of the patient. This is a great example of successful collaboration from ambulance to handoff to the ER trauma team. The third question asks, share an experience where you received unexpected feedback from a supervisor or coach. What was your reaction to that feedback? When starting my CNA job on Sheridan Memorial's Med-Surg unit, my supervisors noted that I sometimes moved too quickly during care, which occasionally made patients feel rushed. The feedback was unexpected as I felt I was providing similar patient-centered care as I do on the ambulance. I realized my EMT training emphasized speed and efficiency, which wasn't always appropriate for the slower, more holistic pace of bedside care. I immediately started using a timer in my head and worked on not speeding through skills and tasks. I made it a permanent habit to pause before starting a task, ask the patient if they have any questions, and ensure my nonverbal cues communicated presence and patience. This intentional shift not only improved the patient experience, but also allowed me to catch subtle changes in their condition by being fully present during our interactions. This simple change also demonstrated to the patient that I respect their time and the care they require. And I was appreciative of the feedback and successfully adapted my EMS speed to the necessary pace of bedside care. Number 4 asks, nursing requires a lot of empathy and strong communication skills. Tell us about a time when you demonstrated these qualities. While working as a medical assistant at Campbell County Health's main clinic, I was rooming an older, non-English speaking adult patient. My task was to accurately complete the intake information while ensuring the patient felt respected and fully understood the questions being asked. I didn't have access to an in-person translator and had to utilize the clinic's teletranslation service to bridge the language gap. More importantly, I focused on my body language and facial expressions to work on making the patient more comfortable. I practiced empathy by slowing down and confirming understanding after every question. By using the translator and moving slowly, I not only obtained the required vitals and medical history, but also built immediate rapport. The patient visibly relaxed and calmed, and this experience cemented my belief that prioritizing compassionate communication is not just a soft skill, but a critical safety measure that directly leads to better, more complete diagnostic data. This confirmed that effective communication is about using the right tools and providing genuine empathy. Lastly, number 5 asks, why should we admit you over other applicants for our nursing program? I believe my application stands out because I offer a unique blend of field and clinical experience, making me a highly prepared investment for your program. As an intermediate EMT, I've executed complex medical protocols and managed high pressure situations. This experience guarantees I can handle the clinical intensity and fast-paced rotations in RN experiences. Conversely, my work as a CNA and medical assistant has grounded me in the sustained and holistic side of nursing required over days, not minutes. I understand both the adrenaline of the initial rescue and the resilience needed for long-term bedside care. In addition to my various experience, I have long-term career goals in medicine. Having found my professional calling in healthcare in my mid-20s, I approach this career with absolute certainty and resolute focus. Ultimately, becoming an RN will provide the scope of practice necessary to gain clinical experience before potentially pursuing a mid-level provider scope, allowing me to fulfill my goal of becoming a specialized practitioner. Lastly, I'm dedicated to representing your institution with the highest standards of integrity and clinical excellence, ensuring I contribute positively to the reputation of your program and the future of the nursing profession. In summary, my history isn't just a list of jobs, it's a foundation built on patient-centered care and professional integrity. I am absolutely confident that I will not only succeed in your challenging curriculum, but will be a positive representation of your program. Thank you for considering my application, and I look forward for the opportunity to discuss my qualifications further. Thank you.